Well, we're nearing the end of what pharmaceutical companies are calling a monumental year for their industry. Drug makers rolled out several long-awaited treatments in 2023. These include the first ever drug shown to slow the effects of Alzheimer's disease, new weight loss drugs, the first over-the-counter treatment for opioid overdoses, new protection against RSV, and the approval of 2 new gene therapies to treat sickle cell disease. Dr. Bayo Curry-Winchell joins us now to speak more about this. She's an urgent care physician and a medical doctor. Thank you for being with us.
Thank you for having me.
So, Doctor, we saw so many remarkable medical advances this past year. We ran through a couple of them here. Talk about the ones that stood out to you. Which ones topped the list and why?
So, we've seen recent breakthroughs that really offer the opportunity to not only prevent, treat, but possibly cure diseases that were previously untreatable. So, my top ones are sickle cell. Now we have the possibility of really going after the cause of sickle cell. And so, this is a great advancement. The other thing that we're looking at is the weight loss drugs that everyone has heard about. This really offers the opportunity to not only treat diabetes, but also prevent all of those complications that are often associated with being overweight. And last, really RSV. This is a illness that has really taken a hold of not only the younger population, but the older population. And now we have a vaccine for those over the age of 60. So these are wonderful advancements that can really make a change in the landscape of healthcare.
I'm just wondering, because we've seen so many of these treatments sort of burst into the scene this year, has something changed in the pharmaceutical industry, or is this normal?
So we really have been able to kind of hone into advancements that can make a difference. Previously, there were, medications and science that really didn't have the support to make the advancements that we can see now. But with AI, genomic sequencing, all of these things have really helped the pharmaceutical industry and especially scientists be able to put forward new medications, new treatments that can help my patients and patients across the world.
And I'm just wondering, looking ahead, what can be done next year? What do you think, pharmaceutical companies should be prioritizing in terms of treatments in the years to come?
So we really need to look at genomic sequencing. I think that's going to be a huge thing for everyone to look at because we want to be able to prevent diseases. And so having the opportunity to know what things you might be at risk for, as well as what other things can we look at when we look at, weight loss drugs, other ailments and diseases. So I think that's a big thing that we have to kind of keep our eye on and really also focus on health equity because with all of these advancements, if it's not available to everyone, we haven't really done our due diligence. So that's the thing that I hope everybody takes a look at, health equity, because it's important that everyone has the opportunity to help themselves and their loved ones.
Yeah, really important. Dr. Bayo Curry-Winchell, thanks so much for your time. We appreciate it.
Good to be here.